Robby, what's on your radar?
Well, for the last year and a half of the pandemic, COVID-19 has served as two distinct illnesses. A respiratory disease, much like the flu, albeit more contagious and more lethal, and in the view of Democratic politicians, technocratic public health officials, and media elites who collectively comprise Team Blue, a sort of spiritual sickness or moral failing that predominantly afflicts the wicked and incautious. Bad people, you see, get COVID-19. Good people trust the experts. They follow all of their dictates, which render them immune to the disease, unlike their sinful compatriots. You know the type, those Trump-voting red state deplorables from Florida, Texas, and Arizona, the ones who refuse to wear their masks and get their booster shots, keep their schools closed. They're bad people because they contracted COVID-19. If they'd been good people, they would have worn their masks, even outdoors, practiced social distancing, canceled their 4th of July plans, pulled their children out of intramural sports, worked from home. All those jobs are that flexible, right? Written off their anti-vax relatives and reported their Facebook posts as misinformation and ordered all of their groceries online. Because that's easy and affordable, right? Who does that sound like, by the way?
Don't you judge me. You're the selfish one. You're the one who charged his own brother for a Bluth frozen banana. I mean, it's one banana, Michael. What could it cost? $10?
You've never actually set foot in a supermarket, have you?
I don't have time for this.
In certain Protestant Christian traditions, the elect are those predestined to enter the kingdom of heaven. No one can be sure that they are a member of the elect, and no amount of dutifulness can change one's station. But performing good works is a strong indicator of elect status. So too with COVID-19 caution. Good liberals have tried their hardest to flatten the curve, even as 2 weeks have stretched into 2 years, with the pandemic more out of control than ever, not just to avoid the disease, but in order to prove their moral righteousness, their devotion to following the science. The most devout have gone to great lengths to outdo each other, especially in recent months, as the widespread availability of vaccines has eroded some popular support for caution. Recently, The Atlantic's Ed Young wrote an entire article about his decision to cancel his 40th birthday party. I still mask indoors, he wrote. I still eat outdoors at restaurants. I still avoid large gatherings. I'm still writing articles that take a toll on my own resilience to help our readers make sense of a crisis that I desperately want to never think about again. I've tried to put we over me. A birthday party is almost the antithesis of that ethic, an asymmetric gathering in which we celebrate me. Denial of pleasure in the name of promoting public health is an essential pandemic sacrament for the elect. On Twitter, the independent journalist Michael Tracy, a critic of repressive COVID-19 mitigation measures, has compiled an impressive collection of liberals explaining their decisions to cancel various holiday plans. Canceled our family fest, wrote one. We are all vaxxed and mostly boosted, but I just didn't want to be one of those people who caused a surge at our local hospital. The closest I got to gathering was my mom picked up a plate of food from my porch, wrote another. Even though we were 12 feet away from each other and outside, we were still masked. So these statements call to mind medieval monastics who wore hair shirts and whipped themselves because suffering brought them closer to the divine. The willingness to deprive oneself of fulfillment was seen as evidence of godliness then and now. The deplorables, on the other hand, are wicked and sinful, a fallen, ailing people. When Georgia first began to lift the lockdowns in April 2020, The Atlantic called it an experiment in human sacrifice. Remember that? That same month, the Washington Post's Jennifer Rubin assailed Florida Governor Ron DeSantis for leaving the beaches open a few days too long. DeSantis' delay in taking steps to save lives, steps that are patently obvious, is reckless in the extreme and morally indefensible, wrote Rubin. This was about the beaches staying open. No state is immune to the virus nor to fatalities, but the difference between the inescapable, unpreventable deaths and the death count that will result from willfully ignorant and stubbornly counterproductive decisions falls on the heads of political decision makers. DeSantis will be morally, if not legally, responsible for hundreds, if not thousands, of preventable deaths. As recently as July 2021, Rubin criticized DeSantis for downplaying rising case numbers. 5 short months later, cases are staggeringly higher than they were in July. But Rubin thinks it's time to stop agonizing over cases. And she's not alone. We're hearing a lot of that now. Little changed between the 4th of July and Christmas, though, except that a great many COVID-19 cautious liberals finally caught it themselves. Despite their best efforts, and the Biden administration has admitted that it's time to move on. In December 2020, the actress Alyssa Milano, who at the time was recovering from a case of long COVID, wrote that she was paralyzed with fear that her parents, children, and husband would soon contract the virus. The fact that they haven't been infected means they are definitely still vulnerable, she wrote. I have nightmares of losing my mom, of my husband, David, in the hospital, of explaining to my kids the very worst news they would ever hear. Someone who struggled with generalized anxiety disorder, I find that this fear adds an entirely new dimension of hell to daily life. A year later, as 2 considerably more infectious variants wreak havoc on case counts, her tune is now this. 90% of people I know have COVID, 100% are triple vaxxed, and thankfully they have mild symptoms. Great, this is the right attitude. Though it's telling that it's only gaining traction among members of Team Blue now that their own tribe is succumbing to infection. Indeed, the sentiment that there's not very much to do at either the individual level or the level of government policy was predominantly a right-wing belief until this very week. Now it's broadly shared by even President Joe Biden, who had suddenly confessed last week that, well, there is no federal solution. That admission is stunning due to its frank honesty. It's equally stunning that it's not receiving more in-group pushback. The Omicron wave, if it even is an Omicron wave, we talk about whether this is Omicron or actually just Delta we've been dealing with, the Centers for Disease Control and Prevention seem less confident with each passing day, but it substantially weakened the liberal desire for pandemic moralizing. Thousands who followed the rules are about to get COVID, wrote Angela Haupt, a freelance health writer in the Washington Post. They shouldn't be ashamed. Her article quotes a 30-something graduate student who recently tested positive for the virus despite all of her precautions. I feel very embarrassed and dumb, she said. It's eye-opening that I feel so much shame from it. I'm realizing how much judgment I was secretly harboring against people who got it before. The pandemic era has seen the ascendancy of the ultimate judge, Karen, a slang term for an entitled, holier-than-thou rules vigilante who will report strangers to their bosses or even the police for failing to don a mask or stand 6 feet away. At the height of the pandemic on the streets of Washington, D.C., I had several encounters with various Karen-type people who heckled me for failing to wear a mask while jogging by myself outside. With any hope, the twilight of the COVID Karens is upon us. More and more people are finally accepting the fact neither militant masking nor social distancing provides such vigorous defense against the disease. Maybe they do a little good, but they're not doing enough good. Everyone who is long since tired of the cult of the COVID Karen, of the quasi-religious shaming that follows any announcement of easing restrictions in red states and red spaces, should see salvation at hand. As I've noted previously, Omicron is coming for the saints and the sinners alike, and it's increasingly obvious that ritualistic, performative self-deprivation cannot ward it off. Karen's twilight has come.
Twilight of the Karens.
You like that phrase?
Twilight of the COVID Karens.
It's just, maybe this is just me, but I have felt this kind of intense, like, shaming of people who don't want to deprive themselves of every aspect of, like, modern life's enjoyments for indefinitely. And there was in blue-controlled areas, there was a lot of, well, you're a bad person unless you're willing to, like, completely engage in no socialization and go nowhere until Dr. Fauci gives his okay. No, something he's never going to do, ever.
No, it's a real thing, and the problem is that there was a justification for it, but it was taken so far that it just metastasized into something, into some type of moral cancer that then swept through kind of these American suburbs, more or less, and a lot of cities as well. In the very beginning, it was so extreme that I was nervous at the time that the overreaction was going to then create a backlash. And what it did is it didn't create a culture-wide backlash. It created two different COVID experiences. The one side stuck with its extreme behavior throughout the entire pandemic up until Omicron, and the other side rejected all of it, even the useful things. And so the admonitions against people who were on the beach. Remember the Grim Reaper? I was walking along the beach.
Yes.
Going to the beach was a good thing.
Right.
Like getting out of your house, getting sun, being in the breeze, not what was actively good for kind of suppressing the virus. We didn't know everything at the time, so some ignorance is allowable. But the level of the moralizing was not justified by the knowledge base. Like, it's okay if you didn't know whether or not the beach was safe, but there was an expressed certainty that you were going to kill people, that the Grim Reaper was walking up and down the beach.
And we joke about it now, but we're all in this together. What we collectively bought into was a shorter period of total shutdown and lockdown to prevent our hospitals from being overwhelmed. That was what our government health officials told us we were doing, and that is what had broad social agreement. Even if everywhere, right. Like the Trump administration bought into that, red states did it. There was going to be a period of that, and then you're right. Then a lot of people were just done with it, but other people have stretched that for months more. Then it was like, well, okay, until we have the vaccines, this is what the cautious are going to do, and then it stretched past vaccination.
Right, and if the counter argument is, well, what we're concerned about is the most vulnerable because this is a lethal disease for many people, and there'll probably be more than 1 million people that die of this before it's over. That's a wild number. If you go back to January of 2020 and tell people there's a pandemic coming that's going to kill 1 million Americans, like you'd be completely frightened and go white in the face at that possibility. But if that's your counter argument, then the place to focus all of your efforts was in nursing centers and among the elderly. And we barely did any of that. Instead, in New York, for instance, they did the opposite. If there was a COVID case, the nursing home was required to take that person back while the company that owns the nursing home was given immunity for anything that might go wrong as a result of this. And so the Grim Reapers were actually walking down the hallways of these nursing homes while everybody was panicking about people at the beach.
And as awful as it is, it's terrible to lose anyone. It's terrible to lose the elderly, to lose grandparents. I looked up the statistic yesterday because I had to write about it in some other context. Average age of death from the Spanish flu, Americans, 28.
Right.
Horrible. So at least we don't have to contend with that. Cross our fingers for no variants that are more lethal for anyone else or for the younger people. But I'm looking forward to what's on your radar coming up next.